going to wait a couple of minutes so people start to come in. Thank you everybody for coming. I'm just going to open up my comments here so I can see what everybody's saying. Okay, thank you, Gabriel. I got that message. Okay, good. So, shall we get started then? It's been 3 minutes.
Yes.
I'm gonna make a little introduction. Everything's perfect. People can hear me. Welcome. Hello, Planet Earth. Welcome to our bi-monthly, we'll try to make it bi-monthly, Facial Team Update. I'm here today with the CEO and co-founder of Facial Team, Dr. Daniel Simon. Thank you for coming. And he will be sharing some news about Facial Team projects and plans for recuperating our activity once the confinement ends here in Spain. So thank you everybody for coming and listening in. And we'll be looking at your comments here and answering some of your questions. So to give a little more information about Dr. Simon and Facial Team to start off with, Dr. Simon and his colleague, co-founder Dr. Luis Capitan, began Facial Team in 2010 in Marbella, Spain. A decade later, their team has grown to an integrated group of 50 professionals with surgeons, anesthesiologists, dermatologists, nurses, psychologists, physical therapists, acupuncturists, coordinators, all dedicated to facial gender surgery patients. Some of the Facial Team's achievements include, on the clinical side, over 3,000 facial feminization surgical procedures have been performed. More than 8,000 patients have benefited from free consultations and orientations on 4 different continents. Within the medical community, Facial Team has award-winning research with 17 scientific publications and a new one on the way, which Dr. Simon will talk about in a minute. A unique training program to train future FFS specialists, and they have conducted CAD lab training workshops for professionals at leading medical institutions such as Johns Hopkins University, Mount Sinai, and at the annual meeting of the American Society of Plastic Surgery. So Facial Team is also on the surgical work group for the 8th edition of the World Professional Association of Trans Healthcare Standards of Care. And this best practices guide it forms the base of the recommendations for the trans healthcare sector. So it's very important, and we're really proud to form part of the team working on that. So enough from me. I'll pass the mic over to Dr. Simon, who's going to first start by commenting on our recently published COVID-safe protocol.
Hello, everyone. Very nice being here for the second time this month. And I'm starting to like this live streams. I think it's interesting, it's fun. And I have learned that I have to look to the camera. I have learned I have to speak slowly. And I think I'm improving every time a bit, at least. So today, of course, that I would like to start by sending a big, big kiss to all the patients that are watching. Also, all the professionals that are interested in our work, big kiss for you all as well. And one thing that I would like to do, and I did last time, but I have to do it again, I would like to send you a big thank you for your support messages, videos. We have been receiving many videos from patients, future patients and already former patients that send support videos to us, telling us to keep going and to not give up. We won't give up, don't worry. And that, you know, how we are so happy that we can be part of the dreams of so many patients. So be sure that we won't give up and we will come much stronger than before, okay? So very interesting. I comment as well on my last live appearance that it's amazing how even until the end the normalcy before the state of alarm in Spain, because of course of the virus around 15th of March, we have had all the patients not wanting to give up their surgery. We had to fight some patients so that they understand it's not safe to come at that time because of quarantine, because they could be grounded without airplanes to go back to their countries. So, I mean, if you can do all this and you are so strong about your decision, how can we not be as well ready and strong to help you as soon as all this gets over? So just another time I'd like to send this message. Well, we believe that when you have a situation like this, Luis Capitan, my partners, he said this in the beginning already, and I just have to confirm. You have two ways of dealing with a situation like this, or you can wait, you can sit and wait until it goes, or you can use that time to evolve. You can use the time to improve your protocols, to improve your systems, to improve your team. And this is what we have been doing. And we are trying to work very hard, and we are doing a lot of work to be able to receive patients with, let's call it a new facial team. We should never be 100% satisfied with ourselves. We always think we need to improve. Could be something regarding surgery, could be something regarding patient care, whatever. We need to improve all the time. And now, since we have time for this, we have been working a lot to make this better, to make the experience better for our patients. These lives are, in my opinion, a way of us being together, of us seeing each other face to face and giving you some support and the confidence that we are here, that we are working. And that's why I want to keep doing these lives to keep this connection that we have with our patient that I know is very strong. So let me tell you quickly what I've been doing in the last month. So mainly in the month of April, which was probably the worst month in the coronavirus crisis, the month where it was from day 1 to day 30. It was a month where everything was in lockdown here in Spain, also in most countries of Europe as well. But we have been doing a lot of work. So we have been doing many Skype consultations. Our Skype consultations, they have reached a record of number of patients asking for this type of evaluation. We have doing them a lot. We're very happy to see that patients, they are just waiting the time to keep going and to have their surgery. So the Skypes is always a beautiful and very effective first step. So I encourage any one of you that didn't have still a Skype, that this is a process that is extremely developed already. We have been doing this telemedicine or Skype that now everybody talks about with the coronavirus crisis. We have been doing this for more than 10 years now. So we have evolved a lot in the way we talk to our patients, in the information we require the patients to send us before the Skype. So it's not about only a video call. We use this video call to understand your needs. We are able to see many things on the face with the pictures and the video. And normally we are able to establish an extremely accurate treatment plan. This plan sometimes can suffer small changes when we see you in person in Marbella, but in general, the plan that we established with the Skype, for example, with a patient from Australia or from America, these treatment plans normally are extremely accurate. And what we are going to perform when you arrive in Spain is going to be that treatment. So don't underestimate the Skypes, because they can really be helpful. You can consider this in the beginning of the transition, or when you are ready for surgery, doesn't matter. A Skype is always going to give you information, and this is what it's about, okay? Another thing that we have been working a lot, big challenge for us. Most of you know we have been working with international events where we see many patients around the world. We have international events in Australia, in the United Kingdom, in the US. We have international events in the north of Europe. We have in Italy, in Brazil. We have many international events every year. And of course, this year, the schedule is already eating us. We have already, in the next week, we would be going to Berlin and Brussels. And of course, it's not possible. The air traffic is still closed, borders are still closed. So we had to break our heads, brainstorm, and see how can we make an event like this, where we see the patients in person in their country, and we discuss things, and we make virtual surgery, and we establish plans. How can we transform this interaction in something pleasant but online? So we have established and we have developed this system where we are going to make a very nice and beautiful day of work with the patients, as more or less as if we would be there in Berlin and Brussels, but we will be here, and it's going to be an online event where we are going to have ready surgeons to enter their opinion in different areas, from the nose or the hair or the face. You have the patient coordinator being online as well at the same time. So it's going to be a beautiful event for you patients from Berlin or from Brussels that would like to inscribe yourselves. It's completely possible, and just write here down, and Lydia can send the link for our landing page. Okay?
It's in there already. The link's been shared, and I'd just like to add that for patients who have already had appointments to see us in Berlin and Brussels that sent us photos, we're even being able to do some of the virtual simulations, which usually you can only get when you come to see us in person. So we've overcome another barrier in that aspect.
Yeah, exactly. So we are putting everything we can on the table to deliver an event that is not going to be exactly the same, but we hope it's going to be very, very close to what we would have experienced seeing you in person. And of course, as soon as the situation changes, we hope to be going next year to Brussels, to Berlin in person, and do the events. Another very nice thing that happened in the month of April, we had two more publications from our group that has been published on the PRS. PRS, it's one of the most respected medical publications in the world regarding plastic surgery. And we have there a publication that is now under review about the jaw and the chin. We have been working on this publication for a long time. I'm going to show you a little bit later. I'm going to show you a bit what we have been working regarding the jaw and chin. And another publication that is now already being published, it's the publication that we did together with the University of Washington. This one was a publication done by Dr. Shane Morrison from the University of Washington and our group, where we made an evaluation where we could see what was the improvement of life quality in the life of patients undergoing FFS. And it's one of the first studies of this type. It's a very important study because it proves the impact of FFS on those patients, and it can lead to future benefits for patients around the world regarding healthcare systems, even private insurances, because we show how FFS, it's not aesthetic, it is a medical necessity. This is the same philosophy that we have regarding the standards of care. So since we have been invited to write and contribute in the standards of care number 8 that will be published soon, we have been putting a lot of effort in including FFS as a part of these standards of care, so that it's not anymore a marginal a collateral procedure, but it's considered then one of the main procedures during the transition process. I hope this can benefit you all after it's published. Another thing that we have been doing and has been a lot of work, and it's going to be changing, of course, in the next months, but we needed to establish the first one. It's on our COVID safe protocol. Okay. So of course, when we are going to start receiving patients, not only we have to be prepared to resume activities, but we need to be prepared to resume activities adapted to this new situation. We understand that what we are going to live now, it's a period of an intermediate period between the appearance of the pandemic and the disappearance of the pandemic that is going to happen or with a drug that is very effective or with a vaccine, okay? But I think everyone already understands the fact that this intermediate period that we are going to live is going to be a strange one, where we are going to be adapting ourselves personally and our businesses, our environments. So Facialteam needed, of course, to do it. We have been working with this protocol that's going to be, of course, let's say, not only affecting the patients, but of course also our staff. And this is the protocol that we have been working that has mainly 4 components. The first component of this is the patient and travel reception. So we are going to help the patients from the moment they leave their country to the moment they go back to their country. We are going to have specific things from the way we are going to pick them in the airport, for the recommendations and exams that they have to make even before they leave their country to come for surgery, the hospital stay, the accommodation, the hotel, everything is going to be prepared for the trip, okay, for the COVID safe protocol. Our installations and office, including the hospital, everything is changed now. It's all prepared to be completely COVID free. So we have, of course, a hospital that is now completely adapted to this situation, with many areas for hand cleaning, staff wearing masks. All the staff, it's now being completely screened about any sign of disease. So we have right now a staff that's completely free of disease. Important that is just a parenthesis, Marbella and the south of Spain is one of the less affected regions in Europe with the coronavirus. So one of the good things is that we have here really small amount of cases. I think yesterday we had only 4 new cases and no deaths. And this has been going for some time already. So Marbella is one of the safest places right now here in Europe. Also, weather is improving. People are being more outdoors, so this helps a lot. Our surgical protocols are also being adapted. We have to wear different gowns, different types of protection. This is going to be, of course, something that we have to apply during the surgeries, but we will also be sure that patients having surgery with us are COVID-free. And we will have testing that will probably happen before patients leave their country, test before surgery, and a test before you leave Spain, so that you can bring with you to your country, to your airline, a COVID-free certificate. Okay. I wanted to show you also very quickly something very interesting we have been working. It's our baby right now. It's the new protocol of our work with Joy and Chin. It's 1 minute. I'm going to show you, but I like so much. So I'm just going to
interrupt you 1 second, Dr. Simon, while you're bringing up the
protocol
presentation. Yeah, about the protocol. The link is in the comments, so the blog is on our website. You can read the specifics about that on our website. And just to let you know, Dr. Simon, you've got a lot of shout outs here in the comments from people from around the world. And somebody says they miss you. Somebody wants to come back to Marbella from France. We have Anne who's saying hello. So just so you know.
Thank you so much. Thank you so much. If someone curses me, you don't tell, okay, Lilia? You leave it. Yes, I forgot, of course. We wanted to make a coincidence or a simultaneous announcement of this COVID protocol that we have been working on the last 2 weeks today in the live, because we just published it, of course. So it's published. What I just explained here is just, of course, in a nutshell, but you can read it. It's very clear, very friendly. You're going to understand very well. So you can go to the link and you will understand. It's said inside the protocol, of course, that it can change. As you know, situations are changing. Different ways of dealing with the problem can appear. So we'll be, of course, letting you know as soon as possible if anything changes. But for now, we have to work with a first protocol, and this is the one we're going to be following. Okay. Very good.
Our coordinators will be in contact with anybody with surgery booked in the coming months to give you very specific instructions about what to do.
Exactly. Patients that are having surgery with us have a schedule for June or for July, they don't have to be worried at all. We know we are every day we are looking at borders, air travel situation, and we are here to help you with whatever you need. Okay. This group of patients from the first months are the ones that we are more focused now to avoid problems with their trip. And we hope that from around August or September, things are more normalized, and then we have a more, let's say, standard influx of patients. Okay, but don't worry. Anything you need, of course, let us know, and the coordinators are going to answer very quick. Let me just share my screen very quick here.
Sure, but if anybody has questions, you can put them down here in the chat, and we'll attend to them as we go along. And says Dr. Simon that that you're an amazing team and everything you suggest is accurate and always in the patient's best interest. You're so rigorous in everything you do and have amazing results.
Thank you so much. Thank you. Here I'm going to put my screen. Okay, very good.
Can everybody see the screen? Let me know. Thank you, Astrid, for all your comments. We hope to see you in Marbella. I think I think your screen share is working, so
perfect.
Go ahead.
So it's a quick thing I wanted to tell you. So we have been working with this for around more than 3 years now. When we started working with lower jaw and chins, this was a work that we did, and it was very, very complex because we had a very small amount of information. There's a lack of scientific publications about how to recontour a jaw, and there was also not the right instruments for that. So the first challenge we had was what type of instruments, what type of incisions, and we have been evolving a lot. We have evolved to a point where we were working with small incisions inside the mouth, as you know. We have been working to a point where we work only with ultrasonic instruments now, so we don't use any kind of mechanic saw anymore. But something was missing. Something still was missing. So what that we are doing right now with the jaw and the chin? Every patient that comes to us, we are performing a 3D scan. This we have been doing for a long time, but now we are taking this 3D scan and we are using it for different things. So this is the type of Piezo surgery we use now. These are specific instruments that cut the bone, only cut calcified tissue without damaging the soft tissues. Okay, so they substitute and they replace any kind of mechanic saw, and they deliver to us a much more dynamic way of cutting the bone without damaging the soft tissues, less swelling, less chance of bleeding, and much more precision. Okay, we have also working with endoscopy at the same time, where the endoscopy, what it gives us is in some patients with a specific complex jaw shape, it helps us to see the more, let's say, distant points of their jaw that we cannot see by direct vision. So the endoscope helps us confirm the cuts we make. And we have evolved to the model surgery and cutting guides. So what is this? Before we have this, we have been working with the scans, we have been doing nice cuts with the Piezo surgery, we have been using endoscopy, but the cuts themselves, when we came to the operating room, they were done as planned, but from our head. So from our sense of direction, from our experience. This is the step that we wanted to go further. So now what we are doing is something different. What we are doing is that we can put that same scan on a planning software developed by us, and this software is going to help us design exactly the type of cut we want to make on that jaw. And this is done previously, of course, before the surgery, okay? After we have designed that cut, what is generated, it's an image that can actually be 3D printed. So what we have at the end, it's what we call the cutting guides. So if I plan, for example, to remove the angles of a patient, after I make that planning on the software, what is generated is this, and this is physical, this is 3D printed, and I can bring this piece to the operating room and it's going to fit on the angle of the patient and I can do my cut. The same on of a chin surgery or on the classic angle to angle cut, okay? Here you understand very well. An example, a patient that comes to us, we do the CT scan, we plan that we want to make this long cut here. This now is planned, but in the software that we have, the software shows exactly the cut we want to make, and what we have at the end, it's the cutting guide. And the cutting guide is going to be used in the surgery to achieve the exact cut we have designed here in the purple area, okay? So this is...
Can I interrupt this for 1 second? This is a template. It's like that
yes.
actually fits onto the bone, and it works like a little template that you can use to cut around, right?
Exactly, exactly. I even have a picture here of the template. So this is a CT scan, a real one, before and after the surgery. So you can see the shape before the surgery and the shape after surgery with no steps, very smooth type of cut. Here you can see. This is another example when we are doing a cut only on the chin. So you want to make the chin smaller. So this is a guide for the chin. This is how it looks in reality. You see, we have a transparent, it looks like an acrylic. It's a special type of material. This is going to be fit on the chin, and we are going to make our cut, okay? And this would be the
Dr.
result.
Simon, I have a question for you that I think some people probably would be wondering. You're talking about getting 3D CT scans and having specific models made. Do people have to do this in their own country? They're going to have to go to all these different labs and spend loads of money? How does it work?
No, every patient coming for FFS with us needs to arrive a certain amount of days before surgery. In general, this can vary from 2 to 4 days. In those days, all the exams that are required for the planning and execution of your surgery will be made in-house. So we will make the scans at Facialteam facilities, okay? So everything you're seeing here is not complex for the patient. It's complex for us, but not for the patients. We will make all the exams and we are going to be able to make the planning, okay?
One question just come up from Simone. She wants to know if she just wants to have her chin shaped, is this something that you do for all patients automatically, or only some patients have the cutting guides?
We tend to use this to all the patients. Even when the changes are going to be small, having your cutting guide with you, it's just going to assure precision. Okay, so and for the patient, it's not more, let's say, complex. The surgery is not more traumatic. On the contrary, it's just an assurance that the surgery is going to be performed as planned on the pre-op consultation. These drawings that we make, that you see here in green, these are done. If I have here patients today that have been with us, they can confirm. We do these drawings with the patient in front of us before the surgery. So we help patients understand what we're going to cut, and having the guide, it's an assurance for the patient that they will have that delivered, okay? And then when we make the CT scan after surgery, which normally we do it 2 to 3 days after the surgery, they can really confirm on their bone, at the bone level, how the results were achieved.
Can they take those home as a trophy?
Yes, you can. Many patients, this is a funny thing, but it's true. Many patients, they ask to keep their bones. It's not something rare here. It happens a lot. Another thing I wanted to comment, that it's another work that we have been doing in the last 2 years, is that since we find that one of the most important things from the experience of our patients when they come to Marbella, it's the stay, the accommodation, because we know that when a patient comes, they will stay with us a maximum of 48 hours in the hospital. The surgery is done, and then they have to stay in Marbella for around 2 weeks. And those 2 weeks, they can be completely different depending on how they happen, where they happen, what type of care do we give. So we have reached a decision that to make the perfect, or at least the most perfect, circle of care around our patients, we needed to control as well the accommodation 100%. So we are now we are in the middle of our project and execution of what will be the Facialteam hotel, Facialteam accommodation, exclusive for our patients, completely designed for a patient recovering from FFS. And this is going to be happening in the next couple of years. The name is Nagoya. We call it the Facialteam experience. This is some images we have of the project that is going to be really, really nice, really cozy, with a small amount of rooms. I think it's going to be around 15 rooms, not more than that. Very, very exclusive service for our patients. And it's our new facilities. Patients that have been in our offices in the last couple of years, they remember it was very white. So now we made it more cozy. We have been preparing these as well, so that when we come back, we can give you a bit more of what you had before. So everything that we want to improve. Very good. Let me just go back to my screen. Just a second.
Dr. Simon, we have a question here in the group. Yes. And how noticeable are the scars from the trachea shave?
Well, trachea shave surgery decision starts with exactly what you're saying, with this patient is saying, where is my scar going to be placed? We see a lot of patients that underwent trachea shave or Adam's apple surgery in centers or with surgeons that perform the incision over the cartilage. I agree that surgically it makes sense because you do the incision over the cartilage, you get very quick access to it, but it has two big disadvantages. One disadvantage is that you're going to place your scar over the surgical area. So it can happen that the scar becomes pinched to the cartilage, and then every time you swallow, you can see the pinching of the skin at that level. And of course, the second thing is that even if the scar is good, but it leaves a small line, patients can be self-conscious about having that small line in the area. We have seen patients that had this type of scar and they have been walking around with a scarf. So it doesn't make sense to do a surgery because you want to eliminate a feature and then you have to wear a scarf to hide the scar. So the incisions we use for Adam's apple surgery, they are always placed between your chin and your neck, never over the Adam's apple. So somewhere between the chin and the neck, normally around here, and the Adam's apple is here. Okay, so you cannot see it when you're looking to someone, no one can see it. And they do not have more than 1.8 centimeters. So a little bit less than 2 centimeters. They are small, they heal very well. They don't have the risk of pinching because they're far from the surgical area and they are in a hidden position. Okay.
Usually in one of these little creases that we have, no hair and very small.
Yeah, sometimes it can be, if someone sees it, because if a patient is like this and someone can see the scar, it can be confused with these small accidents we have when we are children, then when we fall from in the playground. So it's not something to be worried about at all. This is how an Adam's apple should be done nowadays.
Yeah, anyways, it's tiny, and if they do want to minimize the visibility, there are a lot of techniques nowadays to reduce the quality of the scars.
Even in case of a scar not being 100% ideal, which is a possibility depending on the healing of each patient, there are treatments that comes from different types of cortisone injections to resection to laser to dermatography. Exactly. So clinical tattooing. There are so many things that can be done. Okay.
Another question's come up by Simone. I'm not sure if she understands the guides the cutting guides you were talking about, because her question is, if I just want to shave the chin, is the implant mandatory or not? And I think she confused the guides for an implant. Those actually don't stay in, do they?
Good point. Yes, sometimes I explain everything. It's so clear because we're doing the surgery every day, but it's true. Sometimes you see that you think it's going to stay. Those are used during the surgery for a couple of minutes. We place them, we mark the cuts so that we know that what we design on the scan is what we are going to do on this real bone, and we remove it immediately and it's done. We throw it. So it's only a tool for us to work as a guide to show us where to make our cut. It's not something that stays. It's not an implant. Okay.
Right. And she asked earlier if she just was to have chin shaving and not a chin reconstruction. Because with the chin, you're able to change its height, change its width, change its shape. So if she was just having a shaving, would you use the guide?
No, if this is very rare, I must tell you that, because even patients that they believe they only need shaving, when you see the scan, you will see that there is a small amount of bone that needs to be cut as well from the lower part. Okay, let's say you have two volume bone amounts of bone here, volume in this area. So you think, okay, let me just shave this. But as soon as you shave, you still have some squareness on the lower border of the jaw, and it could require cut. But of course, if we identify a patient, it's rare, with a CT scan that only requires shaving, then a cutting guide is not necessary.
And to do the cut, you're using the Piezo tool, which is an ultrasonic tool. Exactly. Can you tell us a little bit more about why this tool is better and in the experience of Facialteam, how you've seen improvements in the post-operative period?
Yes, piezo surgery is a technology that was developed many years ago, and it's based on ultrasonic waves. And these ultrasonic waves, they are not generating movement. So it's an instrument that can cut bone, but it's not moving like a saw mechanically like this. So it generates this vibration. As soon as you touch calcified tissue, mineralized tissue, it starts cutting. So the good thing is that when you are using these instruments to cut the bone from inside the mouth, all the soft tissues around are protected because this instrument doesn't cut or doesn't damage the surrounding tissues. Imagine around the bone here, I have muscle, skin, nerves, blood vessels, all these are intact. And this is what makes the post-op or the recovery so much better, because you don't have the inflammation of the damage, of this collateral damage that normally is caused by a saw. If you cut the bone with a saw, you will cut the bone, yes, but you will also damage a lot of the surrounding soft tissues. And this is one of the main reasons we use the piezo. And the second reason is that since it's not a mechanic instrument, it's just a matter of ultrasonic waves, the tips of the instrument are very different. They are from different types of shape, of size. So we have tips that make crazy angulations, and they have different sizes. So we are much more free to work in every areas of the jaw. And when you work with a saw, there's very limited amount of positions a saw can be, which doesn't help us with the design when we want to make a very specific design on the lower jaw.
Have you worked with the fabricators, Mectron, on creating a tip specially for certain FFS techniques?
Yes, we have, since we have been one of the first centers applying this technology to FFS, because it's technology that has been applied in the world for a long time. We have been working together with one of the main companies that fabricates this type of instrument. We have been working with them to develop specific tips, specific points that have the correct angulation and size for specific maneuvers that we need to do during the cut of a lower jaw and chin. These are small details, but they make a big step up from the quality of the surgery, speed of the surgery, and safety of the surgery. So yes, we constantly work with different providers to improve products so that we can make those products more adapt to FFS. When we started in FFS, what we had in front of us was a big amount of instruments, machinery, and techniques that were not for FFS. And we have to start taking each one of those and adapting them to our reality. Nowadays, we have specific tips for FFS, specific instruments, surgical instruments for FFS. We even have a specific box that we give to our trainees when they come for training. We have a specific software to plan jaw contouring in FFS. So I think this is a big difference from 10 years ago, when we had just to adapt things and work in FFS, when now we are able to create things specifically for FFS.
On the topic of ultrasonic tools, someone's asking, doctors who use the Piezo for open rhinoplasties, they're asking, the stitches are all dissolvable except for the tip ones. Is that correct? And are there a lot of doctors using Piezo in rhinoplasties?
Well, rhinoplasties done with Piezo surgery is a new trend. I would dare to say that it's not the majority of the surgeons that operate noses that are using Piezo, but I would dare as well to say that it's the future, because you are now substituting the old hammer and chisel for a very high technology machinery that doesn't damage the soft tissue, that is very precise. So we are now working all our rhinoplasty procedures done with Piezo. Also, we are also developing with the same software we have for the jaw, we are developing the design of the cuts we do on the nose as well with cutting guides. So yes, it's a very new thing. I know that many surgeons like to use Piezo surgery for rhinoplasty. We like to use. And regarding the stitches, I will not answer this because I'm not 100% sure. I don't remember right now exactly what Dr. Bejinga, our nose surgeon, was using on the tip. I believe that now he's using almost all of the stitches resorbable, but I'm not 100% sure. If he's watching, he will answer, but I'm not 100% sure.
And maybe our helper here can send a little message to him and we'll get an answer before we finish today. A new question's come up. Someone who's cisgender in the group, a female, and she's not quite happy with her brow. Her forehead, she says, seems a little forward and casts a shadow over her eyes. Is this surgery which would be an option for her?
Absolutely. We have now, since we started our work, we have been having and receiving more and more cisgender patients with specific features on their face that bother them. Okay, we could use an example of a cis woman that has overdeveloped brow bossing, for example, and this makes her expression look masculine, extremely common. And the techniques that we use of FFS in our transgender women, they will work exactly the same way on a cis woman, addressing that masculine feature and working, giving her a much more feminine expression, a better position of the eyebrows, and a very good result. Actually, we have been, what we see is that many patients, many cis women in general, that are looking for eyebrow lift, which is a common procedure, right? I mean, how many cis women are looking for raising their eyebrows? And it happens in many times that those patients, they are looking for a surgeon, and the only solution that is presented to them is raising the eyebrows by the means of surgery, stitches, suspensions, and different techniques. In many cases, what we identify is that this eyebrow that the patient wants to raise is actually covering a large amount of bone that should not be there in the first place. So what we are now reaching is the point where we see that feminization of the forehead has a large field of work inside aesthetics of the upper third. Because if you're doing a brow lift and you want the best possible result, eliminating the excess of bone on the area should happen at the same time. So not only FFS techniques can help cis patients with exaggerated features, such as a forehead or a strong jaw, but it also can be an associated procedure to potentialize results of plastic surgery being performed for rejuvenation, for example. And yes, these are all, let's call it coincidence, but this is all the evolution of the techniques that we have developed for FFS, but they have a lot of application as well on cis patients.
Perfect. I think that answered the question. Excellent. And there's another question that just came up from Irene. She says she needs all kinds of interventions and wanted to start by asking, since she has hair loss on the top of her head, is it possible for her to do grafts in the same feminization session?
Yes, we have published an article in 2017 where we have created a classification where we study more than 400 patients and study their types of hairline. Okay, so we have to see if Irene, what type of classification she fits. If she's a number 1 to 5, we have 1 to 5, and each type of classification, which starts with normal, round, full hairline, then type 2 is normal height but a little bit M shape, and it goes forward like this. When we can identify that, we can, let's say, suggest the ideal plan regarding the hair. It can go from doing nothing on the hair to doing very advanced simultaneous hair transplants that can be performed in the same day of the forehead surgery. It's one of the most, let's say, search procedures in Facialteam. From our patients, they want to do a forehead feminization with a simultaneous hair transplant. It's a procedure where we are going to address the bone, the bossing, but to address that bossing, we are going to perform an incision in the top of the head, hidden inside the hair. That incision is going to give us the opportunity to do two things. First, it's going to give us the opportunity to approach and see the bone of the forehead. But the second opportunity is that it's going to give us hair follicles from the incision itself, and these hair follicles can be used to reconstruct your hairline. So it can be used to close a corner, to bring your hairline down, many different things. Of course, every patient has a different indication, okay? So hair is one of the focus of Facialteam works and study, because we know that working alone with the forehead in many patients, leaving the hair aside is not going to help to achieve the best possible result. And the upper third of the face is a combination, at least in FFS, it's a combination between bone shape and hairline position and design. Okay.
Excellent. And new question just came up here regarding the V surgery in terms of the, you know, the popular Korean jaw V surgeries. Why are the guides so important for this surgery? And would it be possible to do the V surgery in Spain?
V-line surgery or V surgery, it's more of, I would call, it's a term that it's used in general, but it doesn't mean so much. When you're wanting a V surgery, what you actually want is that your jaw is more narrow and that the tip of your chin is more triangular or more narrow as well. A V-line surgery, a technique that tries to make the jaw very thin and very narrow, should not be applied to all the patients. So the patient should not look for V-line. The patient should look for the best possible technique on her case. We do V-line surgery, but only in patients where the V-line is going to be helpful. In some patients, doing a V-line is going to be not good. For example, we have patients that they present a beautiful jawline, that you can see the jawline is a jawline that it's marked, it's visible, it gives her personality. And doing a V-line, which means an aggressive cut up to the top here, is going to leave the jaw very absent or very poor. So a V-line for that patient is not a good idea. V-line technique in itself should be performed together with the guides that we have mentioned. Why? Because when you're doing a cut in a bone that is bilateral, like is the jaw is one bone, but it has both sides. There's only one way to assure that your both cuts from the right and left is going to be symmetric. It's by using a cutting guide. Even with very experienced surgeons, if the surgery is not in his best day, how can you guarantee that the cut is going to be exactly the same on both sides? You have to take into account that the jaw surgery is not performed with full vision. We cannot see the whole jaw when we are doing the surgery. We have small incisions, one here, one there, and one there. And with these three small incisions, you have to make a cut from here to here all over, and it needs to be symmetric. So I believe that if it is in my jaw, I would like the surgery to be very well planned and precise. So being a V-line or being a more conservative type of cut or being just an angle cut, doesn't matter. Having a guide is just going to give more assurance of precision. And I believe that all patients, they would like to have that in their procedure.
Absolutely. And we have a person here saying that they don't understand English. They're from Italy.
Parliamo italiano un poco, Lilia.
Parla italiano.
Parliamo, tu sai. Facciamo la cirurgia della macella e del mento.
All I can say, I don't know if she understands me, is that we can do our post-operative presentation in Italian, as one of our coordinators does speak quite good Italian. So we'll work on getting Italian out there one day.
Yes. We were planning, I think we have been to Italy this year, right?
This year, no, last year.
It was not in January?
Oh yes, Rome. That's right, in January, Rome. Forgot about that.
We have been in Rome in January. We were planning to go again probably this year, but we are not sure now if we're going or not. But yeah, Italy is a very important country for us. We have been having patients from Italy the last 10 years, and per questo parlo molto italiano.
Dr. Bijinga has got our answer about the stitches. Yeah, he said all the stitches are dissolvable, but the ones placed in between both nostrils, which are removed in 7 days. Okay. So yeah, so just the little bit here in between that still has a few stitches that need removing. Yeah. And they do that in Marbella before you go. One of the other people here says they'll help with the translation, the Italian translation. Good. That's very nice of you. Thank you so much, Simone.
Thank you. Yeah, and let's see if on the next live, not only I can update current situations, but we probably could make a small, you normally do on Facebook video when you ask patients about specific subjects, and I can go more deep, showing more pictures. I will not show blood pictures, but I can go more in depth about one procedure. We can talk about forehead, we can talk about jaw and chin, specifically how we do, what are the steps. There's no problem at all. This would be really, really nice to do if it's something that interests the public.
Absolutely. So if you're watching this video posterior to the live stream, please make comments and let us know what topics you want us to talk about. Dr. Simon, Small asked also about seeing live surgery, but seeing actual surgery procedures. Is there any way of doing that? Is that possible?
Who is asking? Sorry.
The same patient who asked about, who's cisgender, who asked about having surgery, even though she's not trans, and she said she'd be interested in seeing surgery.
Yes.
Videos.
In all these years that we have been working in Marbella, we have had many patients that asked to see surgery. And interesting, but not one patient had passed out. So all the patients, they have been well looking at the surgery, and they were not very impressed with blood or anything. So yes, it's a possibility. I not at this time, of course, because of the new COVID-free, COVID-safe protocol, we are not allowing extra people inside the operating room. But as soon as the things get back to normal, we will get back to the possibility of patients watching surgery. This always requires that the patient having the surgery allows the patient that wants to watch to come and see. Normally, there's no problem, but it's important that you watch the surgery of a patient that signs a consent saying that she allows you to watch her procedure. Okay, but it's not an uncommon ask, and I actually think it's very nice. And Facialteam has always been completely open, not only regarding the way we work and techniques, by publishing everything we do on international journals, by giving presentations all around the world and giving courses to surgeons, but also very open about where we do our work. So if a patient wants to come and see how things are done, how the team works, how is the system of Facialteam, you are invited, and we'll be 100% happy to have you.
Fantastic. Also, regarding viewing surgeries, we do have some 3D videos on this YouTube channel. So they're not actual videos of surgery, but you get an idea of how the technique works. And we'll be coming out with some new 3D videos this year, probably. So
yeah, we're updating the 3D videos, and the first one that we are going to release is the jaw and chin, which will be very soon.
Absolutely. So Irene, just to let you know, the Spanish live stream, basically the same kind of update by Dr. Capitan, Dr. Simon's colleague, will be next Thursday on Facebook. Okay, so come back and to our Facebook fan page to see Dr. Capitan do his update in Spanish, en español.
Yes.
Somebody
También
was
hablamos español, ¿eh? También hablamos de español.
Hablamos muy bien el español. Andaluz. Okay, so let's see. I'm just reviewing the questions here. Here we have a new question. Is getting the feminine nose right the key to FFS?
Wow, good question.
What is the key to FFS? Is there a key?
What is the key to FFS? It depends.
Is there a key?
I think there is a key to FFS. I think the key to FFS is that you are able to identify on each face individually what are the areas that were affected by puberty, which are the areas that are not keeping that face in balance. So to say that one procedure is the key would be not ideal, because then a patient that doesn't need a nose surgery would want a nose surgery because she thinks that she needs to have it because it's the key. So the nose can be a key in FFS on a patient where the nose is very masculine and it's calling attention and it's breaking the feminine effect. In some patients, the forehead is the key of the FFS. We have done a study together with Stanford. This is a study that is I'm not even sure it's already published or it's being published now. It's a very interesting study where they use eye tracking devices in voluntaries, and those voluntaries with eye tracking devices, machines, they had to see pictures of patients, cis women or trans women, and they have to identify them as male, female. And those eye tracking devices, they were showing the researchers where were those voluntaries looking at. And the results show that one of the main and first areas the voluntaries look, it's the T area, forehead and nose. So yes, this area is one of the first areas that non-surgeons, so people on the street, on a mall, on the beach, is where they look at the first glance, the first millisecond to identify gender. I think the nose is it's a very important part when it is not correct, okay? But at the end of the day, to reach the best result in feminization, you have to follow 3 pillars. And those pillars are: first, you have to do a surgery that you obtain a natural result. Surgeries that leave on the patient artificial aspect of plastic surgery, when the age doesn't match the result. We have patients that are very young that receive liftings or procedures that make the face artificial. It's not ideal. This is not FFS. This is extreme makeover. It's another type of surgery. A second pillar, which is very important, is that we have to work with hidden scars. You're doing a surgery that you want to live with that result for the rest of your life. You want to forget about the surgery. You just want to go on. And having scars, of course, it's not ideal. So we have to be working and keep developing ways of making invisible or hidden scars, and to make the results even better for the patient. And the third pillar, probably the most important, is that FFS done correctly, in my opinion, in the opinion of the facial team group, it's FFS that doesn't change the core identity of the patient. It's a surgery that the patient can have, and the procedures that we perform are not going to make the core identity disappear. A family member, a friend will easily look at the patient after surgery and see her there. She's there, but now she's more feminine, she's sweeter, she's softer, she's fresher on the expression, she looks nice, she looks happier. So for me, it's much more looking for those 3 pillars and using our armamentarium, our tools that we have of different instruments, different procedures to reach that, to achieve that. But I don't think there's one procedure that should be called the key one.
I'm just putting into the group now a link to our page on our website. That's basically what Dr. Simon's talking about, our philosophy in terms of the 3 pillars that he mentioned. Okay, I'll put the link in here now. And at the moment, okay, Irene is saying thank you to another person here regarding Spanish, getting Spanish in there. Sí, no hay problema. Español será la semana que viene. There's not any other questions in the group at the moment, but I think it would be interesting for you to talk about a question I've seen come up on other forums, is that with the Skype consultations that we're doing a lot of right now, some people have said to me, but isn't it better to have a person-to-person consultation?
Yes, good question. Of course, having a person-to-person consultation is always going to be better than a Skype. This is a fact. But when you cannot have that personal consultation, a Skype has a lot of value. We see patients, I think right now, more than 30% of our patients come from Australia, for example. It is not feasible for patients from Australia to come to us. It's a big trip. We go to Australia every year, so I know it's a very big trip just for a consultation, to see us in person, then go back and then come for surgery later. We have been developing the Skype method for many years so that we are able to achieve a very precise plan. Sometimes a small detail needs to be finally confirmed when the patient is in Marbella, but this is not going to change the result or the surgical plan. So ideally, what do we want? We want to touch the face of the patient. Ideally, I want to have a CT scan of the patient. And on a Skype, we cannot have all this information. But we know for sure this is something that works perfectly well, is that doing a Skype is going to give a lot of information for the patient regarding the surgeries that the patient needs. Is going to give a first chance to interact with us, to feel a bit us, if there's empathy, if there's a good connection. you know, that sometimes it's not about being the best surgeon, it's about connecting with your surgeon and having a good feeling that this is the person or this is the team that I think is going to help me. So Skype gives that as well. Even this, I think that one thing that's going to happen from this crisis, a good thing that happens from this crisis is that it forced many of us to work and interact with other people through platforms like Skype or like Zoom. So I believe that people are losing a bit of their prejudice on this type of communication and seeing that it can be really useful, and it's really useful for an FFS consultation as well. And I hope that it has helped the situation for this technology to reach more people that now use them and feel more comfortable with them. Okay, so yes, it's better in person, but if you cannot come, a Skype will help a lot. And if you can come, of course, we will be very welcome to be in Marbella with us. We'll make a CT scan as soon as you arrive. We'll make virtual simulations on the pictures. We'll see you in person. You can see the spaces. So of course, it's amazing. But if not possible, a Skype will help.
So touching base on the topic, you mentioned that it's important to feel comfortable with your surgeon, and we see people who have had FFS before. Can you talk a little bit about that? And do you receive patients with problems from previous surgeries?
Redoing, it's a term that we use a lot in FFS. So we have to do again something. I believe there are two things that are very positive that happen for the discipline of FFS in the last 10 years, let's say. So from one side, you have more surgeons interested in performing this type of procedures, but at the same time, you have surgeons that are interested, but they want to do it very quickly without having enough training or expertise. So of course, you have more FFS available around the world, but not all of these FFS has high quality or assurance or experience behind it. So it became a trend that we see more and more patients that needs to come to us for a second FFS, a revision surgery. It depends. Sometimes it's a surgery that we need to do because what was done was not enough. So it was a surgery that was poor, that we need to do more, we need to go further. But then you have the other problems that I believe are even worse, is when the surgeries went beyond where they should have gone. And this gives us more problems because it's much easier to remove more bone than to replace bone or replace structure, replace nerves. This is much more complex. So redoing is a reality. I believe there are many centers around the world right now that are able to perform extremely good FFS, but patients, they need to do what they do. Most of the patients, they are not going to choose a surgeon just because the surgeon has a nice picture on a website, but you need to see if this team has experience, if this team has been working with patients for a long time, if you can talk to previous patients that tell about their experience. As you know, it's not about only the surgery itself, but how was the process from booking to a year after post-op? How was the follow-up, the post-op care, immediate post-op care and late post-op care? You don't want to do an FFS, a big procedure like this, and not be feeling completely safe that if you need anything in the first months, you'll be quickly addressed and we are going to quickly help you. So redoing is a reality. You have to be careful. Sometimes what is cheaper at the end, it's more expensive. So yes, we have to be very careful with when you choose exactly the surgeon you want to have your procedure.
We have a question about our price policy. I don't know if you can make some comments about that.
Yes. Well, the price policy of Facialteam is a price policy that has been following in the last 10 years. And it's a price policy where we apply the same cost for a procedure independent on the patient. So forehead surgery will cost a forehead surgery to every patient. A jaw surgery costs the same for every patient, a jaw and chin the same. So it's a policy that makes costs equal because at the end of the day, what it requires from the surgeons is a certain amount of hours. A forehead can be more complex or more simple, but it normally requires the same amount of hours in the operating room. So we don't think it would be interesting even for the patient to be seeing every instrument and every material you use. You're going to charge over the patient for that. It's better to have a more uniform price And then it's easier to make the planning of the costs, and it's much easier for the patient as well to understand the cost of their surgery. Also, when you have a quote from Facialteam, as you know, there are many things that need to be included because it's a surgery that requires hospital medications, it requires a big team, it requires parallel therapies that will happen during your stay in Marbella. So there are many things that are in there that are not only, let's say, the surgical part. Okay.
An important question too is, how can patients become better prepared? What is the minimum that you recommend that patients have done before considering FFS? Is sort of what order of surgeries do you recommend normally?
Well, normally what we recommend is that the secondary aspects of the face are or completely addressed or partially addressed. Secondary aspects, what I mean is that facial hair is already being removed. If possible, hormone therapy is in place so that the skin quality is improving. All these things are going to help potentialize that the result after surgery is going to be more visible, more pleasant. So first, if we keep to the face, I recommend, of course, that you do hormone therapy at least 6 months. Some patients, even a year is necessary. Facial hair removal, if possible, should start at the same time. And every time we mention any kind of surgery during a transition process, psychological support is advisable, of course. So if you can have a psychological support, I mean, it's a big step for any person to have a surgery, to go through a process like this. So having this support is important. We don't dare yet to talk about orders when we discuss SRS, gender surgery with facial surgery. We believe every patient has their history, every patient has their justifications for not doing something or doing something before another thing. So I think that in the ideal world, I would recommend face first. But anyway, for many patients, this is not something that is a reality. And sometimes gender surgery needs to happen before the face. It's no problem. Okay, but I think that we have to adapt to each individual case.
One person here is saying that hormones don't change your bone structure. So why is it necessary? Why do you really recommend? Can you go in more detail why
Yes.
hormones are recommended?
Well, hormones, they don't change the bone structure, but they do change the soft tissues around that bone structure. So hormones, for example, on the jaw area, it can change the thickness of your skin, it can change the thickness of the muscles, it can change the fat distribution. So even in some areas, it could change the surgical plan. In a patient, for example, that has a wide jaw, and we see that this width is given much more because of the thickness of the muscle than from real bone, hormone therapy is going to help, because in many cases, this hormone therapy is going to make muscles shrink, suffer a process we call atrophy. And then when you see the patient 6 months, 1 year later, that width, it's gone, or at least it's much better, much improved. So then the hormones have changed something on the jaw. Or for example, the change on fat distribution around the cheek area. Some patients, they want to have cheek surgery as soon as they arrive to us before starting transition. We say, okay, let's wait for hormone therapy. And after hormone therapy, this area changes, okay? So this is one of the reasons. And the second reason is the one I told you before. If you have the hormone therapy before, let's say that the canvas, your face, is more prepared for the surgery, because then when you start recovering from your bone surgery, what you see is not the bone. What you're going to see after recovery is the soft tissues covering that bone. So it's much nicer for the patient to start seeing already a result that is going to be more feminine, more stable in time. Okay, I prefer to see a face that will have no facial hair around a jaw that has been operated, because then the result is going to be nicer as well. So these are main reasons why we would prefer patients to do the hormone therapy at least 6 months to a year before.
And the same person is asking now, what about the forehead, the orbital area? Do the hormones make any changes in that area?
No, unfortunately, no. There's no scientific evidence that hormone therapy will change the bony structure of the forehead. Can it change the muscles? Some patients have very thick eyebrow muscles here. Can it change it? Probably yes, it can change, but it's not going to be affecting the forehead as we imagine. On the other hand, hormone therapy will affect the upper third of the face because of the hair. So in many patients doing hormone therapy, you start seeing corners becoming filled with hair. It's a reality. So a patient that was, for example, planning with us a surgery of the forehead with a simultaneous hair transplant, after she has done the hormone therapy, suddenly when she comes for the consultation, the area we were going to transplant, it's filled in with her own hair because the hormone therapy activated the follicles in the area and they have their hair, that regrowth happening. Okay. So yeah, hormone therapy, it's important. Not all the patients are able to have hormone therapy because of different types of health situations, kidney problems, cancer, so thrombosis. But for the patients that are able to have hormone therapy, we recommend because it's very useful.
So in so much as that, you know, the order of surgeries may vary depending on the person, their health status, and their situation, etc. When is the right time to have a consultation? Would you recommend you have to wait until you've done everything and now it's time to have a consultation about FFS, or can you have multiple ones?
Well, of course you can have multiple ones, but I strongly believe that the best time to have a consultation is as soon as you want to talk about it. If a patient is still in the beginning of the transition, even that didn't even start taking hormones, is still presenting herself on a masculine role with masculine clothes, even that moment is good, because if you think about it, one of the main problems I believe patients have when they're starting a transition process is that they have such a big they have such a big path they need to follow, and there's so many questions and doubts that every information that starts to clarify that path is very useful. So if you come to a consultation when you're starting and we talk, we explain you what is FFS, we remove the myths, the bad myths mainly, and we can give you an initial possible plan that you will have. I believe patients go out, and I heard patients tell me this, they go out of the consultation and it's like they can check the box and they say, okay, when it comes to my face, I know at least what I have to do, what is this type of surgery, and then the patient can concentrate in other things. She can concentrate in therapy, she can concentrate in the SRS, she can concentrate in researching the voice and everything. But at least a box is checked, information is given, and I believe this is one of the main weapons for the patients to decrease and reduce anxiety, make the experience more light. Okay, so I strongly think that the patient should have this information as soon as possible.
Absolutely, from the beginning if possible. And updating as time goes, because some patients take years before they're able to have their surgery. So, and things change. A lot of things change both for the patient and within the industry over those years. True. So, someone here in the group is asking about WPATH and our connection with WPATH. We already talked a little bit about that earlier, but I don't think we really defined why is it important that Facialteam is on the work group for the facial feminization chapter. Has the standards of care had a chapter on facial feminization in the past?
Maybe I'm wrong. Sometimes I confuse the numbers, but I believe what we are writing now is the standards of care number 8.
Number 8. It's number 8.
Number 8, right? So standards of care number 7, they were from 2011. Okay. So imagine what has happened in the world in the last 9 years. And inside gender confirmation surgery, so much has changed. At that standards of care at number 7 in 2011, facial feminization surgery was not even considered, was considered an aesthetic collateral procedure that a patient didn't need actually. So it was not very, very strongly advised at all on that document. So WPATH has identified it, of course, and we have been very, very close to WPATH since 2013-14 in all the meetings. We have met most of the board, and we have seen that contributing to the new standards of care can change things regarding FFS, because if the standards of care is one of the main and important documents, guidelines for gender confirmation surgery in the world, and this document contains information that shows and explains why FFS is important, this is going to change the level of FFS as a discipline inside the transition process, not only for surgeons, but for public health systems to private health systems and countries, even governments, even political situations. They need to base themselves on the guidelines, and then the face is not aesthetic anymore. Now the face is something that should be considered something serious. So I think it's very important. I hope this can be a seed that Facialteam can put, and that when even if we don't exist anymore, that we know that we have helped transgender women around the world to reach higher quality of life by having these documents evolve in this manner. Okay.
I just put the link to the SOC 7 as a Standards of Care 7, which is the version which was published in 2011, as Dr. Simon said. A question just came up. Is it possible just to come for a hair transplant?
Yes, of course. We have been working with the same team of hair transplant for the last years, and they have specialized, of course, in hairline feminization. So they are amazing. It's a team with 3 surgeons and more than 10 hair technicians. They are there doing very strong, detailed, high-level work of hairline feminization. And we have many patients that come to us just for the hair transplant, or patients that came to us for other procedures and later they come just for the hair transplant. So patients that visit us twice, okay? So yes, we have the service of hair transplant inside Facialteam when it's done alone.
Excellent. Another question. So understanding that Facialteam are like teachers for other professionals. I mentioned that in my introduction, that we have the training program and training workshops. Do you want to talk a little bit about those?
Yes. We have started, let's say, we have started to spread a bit of the knowledge of at least of what we believe was one way, a good way in our opinion, to do things by working with publications. So we have worked to publish our work in techniques. In 2014 or 13, I believe, was our first important scientific article where we have described how we do a forehead surgery. Since then, we have been publishing constantly to show all the professionals how is our protocols of work. One of our latest articles published this year is an article that only focuses on the protocol of diagnostic. So we help surgeons to understand when you have a patient that needs FFS, how do you start with the diagnostic, treatment plan, post-op care, what type of tools, diagnostic tools you have to use, what type of pictures you should do before and after, and all that. We have evolved from that, not only with publications, but we have started giving presentations and lectures. We have been invited for many places to give lectures about our work. And this has generated a lot of curiosity from other professionals, of course. And then we have evolved another step where we started to make hands-on workshops. Those hands-on workshops are normally done in cadavers. We have done these workshops twice already at Johns Hopkins in Baltimore. For surgeons in America, but many surgeons from other countries came as well for this workshop. And we have been doing as well our hand-on workshop in Marbella every year. This year we have canceled because of the current situation, but we hope to resume these activities next year as well.
Fantastic. Well, I think at the moment we've answered all the questions that have come up in the group, Dr. Simon, and I assume you are hungry. I am.
Yes.
We've been going now for quite a while, so
did we keep some interest, or are we talking to ourselves?
No, we've got interest. We've got interest, and there's plenty of interest, and there's been lots of questions. And this video stays recorded here live in our YouTube channel. And please, everybody who's here, if you're interested or if you're listening later on to this video, next week on on Thursday, and we'll have more live streams. And on the 21st, Dr. Capitan will be giving an update in Spanish. En español, el 21 de mayo, Dr. Capitan dará una actualización de Facialteam. And on the 19th, our post-operative coordinator, our post-op guru, she will give a live stream again on our aftercare systems. So she has a fantastic presentation. Please come back for that. That will be on our Facebook fan page. And you can visit our blog, which has the schedule of all of our live events. And also, please, Here in the link right now, we are putting a link to our newsletter. So sign up for our newsletter in order to receive notices about when we'll be live and when we have new blog posts and our new scientific articles and technologies and other training activities and events that are happening here at Facialteam. So thank you everybody for coming. Thank you so much. Thank you, Dr. Simon, for such a great talk about all different things.
You tell me because you tell me I'm the boss, so you tell me these things. I don't believe you.
No, it's true. It's true. You express
you,
yourself very well. And
Thank
from the last live stream on Facebook, a lot of people have talked to me about it, they've seen it afterwards. Maybe they weren't there at the time. And many people have said how natural you are speaking and how it really shows that you're passionate about what you do. So.
I've been watching a lot of lives from Stephen Colbert, David Letterman to learn how to.
And it's great.
I want to thank you everyone as well for being here today, and just be reassured that we have been working really hard to make not only Facialteam adapted to this current situation. No, this is it's a phase, it's a stage, but we have been working really hard to make Facialteam go a step further, to go up on the ladder of evolution, and we really are extremely excited to what we are going to be able to deliver as soon as we resume activities. And you know, we remain by your side here. Anything that you need, you can let us know. Skypes are available. We are having much more availability for Skypes during these months of no surgical work. And I hope to see you soon in the next live with more interesting subjects, more questions. And yeah, a big hug to you all. Of course, stay safe. If you are in a country that is doing quarantine, please remain home. I have been home for 50 days already, and I have 2 kids and a dog. It's possible, but yeah, it's what we need to do to help everyone. Okay, big kiss to all.
Thank you. Bye-bye.
Bye.